Porcine parvovirus causes reproductive failure of swine characterized by embryonic and fetal infection and death, usually in the absence of outward maternal clinical signs. The disease develops mainly when seronegative dams are exposed oronasally to the virus anytime during about the first half of gestation, and conceptuses are subsequently infected transplacentally before they become immunocompetent. There is no definitive evidence that infection of swine other than during gestation is of any clinical or economic significance. The virus is ubiquitous among swine throughout the world and is enzootic in most herds that have been tested. Diagnostic surveys have indicated that PPV is the major infectious cause of embryonic and fetal death. In addition to its direct causal role in reproductive failure, PPV can potentiate the effects of porcine circovirus type 2 infection in the clinical course of postweaning multisystemic wasting syndrome. PPV is classified in the genus Parvovirus of the family Parvoviridae. All isolates of PPV that have been compared have been found antigenically similar if not identical. PPV is also antigenically related to several other members of the genus. However, its identity can be established by relatively stringent serologic tests such as virus neutralization and hemagglutination inhibition. The biophysical and biochemical properties of PPV have been extensively studied and are summarized as follows. A mature virion has cubic symmetry, 2 or 3 capsid proteins, a diameter of approximately 20 nm, 32 capsomeres, no envelope or essential lipids, and a weight of 5.38 × 106 daltons. The viral genome is single-stranded deoxyribonucleic acid with a molecular weight of 1.48 × 106. Buoyant densities of complete infectious virions, incomplete empty virions, and extracted virion DNA are 1.38 A circumflex 1.395, 1.30 A circumflex 1.315, and 1.724 respectively. Viral infectivity, hemaggglutinating activity, and antigenicity are remarkably resistant to heat, a wide range of hydrogen ion concentrations, and enzymes. Replication of PPV in vitro is cytocidal and characterized by rounding up, pycnosis, and lysis of cells. Many of the cell fragments often remain attached, eventually giving the affected culture a ragged appearance. Intranuclear inclusions develop, but they are often sparsely distributed. Infected cultures may hemad slightly. Cytopathic changes are extensive when cell culture-adapted virus is propagated under appropriate conditions. However, on initial isolation several serial passages of the virus, or, better, the infected culture may be necessary before the effects are recognized. The use of immunofluorescence microscopy greatly increases the likelihood of detecting minimally infected cultures. Primary and secondary cultures of fetal or neonatal porcine kidney cells are most often used for propagation and titration of PPV, although other kinds of cultures are also susceptible. Replication is enhanced by infection of mitotically active cultures. Many cells in such cultures are in the S phase of their cell cycle, wherein the DNA polymerases of cell origin needed for viral replication are available. If either fetal or adult bovine serum is incorporated in the nutrient medium of cell cultures used to propagate PPV, it should be pre-tested for viral inhibitors. The same may apply to sera of several other species. Because replication of PPV is affected by mitotic activity, the effect of the serum on the cells is also especially important. In addition, cultures should be pre-tested for PPV contamination. Cultures are sometimes unknowingly prepared from infected tissues of fetal and postnatal pigs. Moreover, PPV can be accidentally introduced into cultures in several ways, including the use of contaminated trypsin. If contamination is detected before all cells are infected, the virus can be eliminated by repeatedly subculturing the cells in the presence of nutrient medium containing PPV antiserum. Several investigators have used if microscopy to follow the development of PPV in cell culture. In general, the sequence of events is as follows. Viral antigen is detected in the cytoplasm of cells soon after infection, if the inoculum contains a high titer of virus and viral antigen. Most, if not all, of this early cytoplasmic fluorescence is the result of antigen phagocytized from the inoculum. By sequential examinations, such antigen can be demonstrated first on the external surface of the cytoplasmic membrane and later within the cytoplasm, often relatively concentrated in a juxtanuclear location. The first unequivocal evidence of viral replication is the appearance of nascent viral antigen in the nucleus. In at least some infected cells, nascent antigen next appears in the cytoplasm in sufficient quantity that both cytoplasm and nucleus are brightly fluorescent. Infected cells commonly seen in the lung of fetuses that develop a high titer of antibody for PPV probably represent this stage of replication. Affected cells subsequently round up, become pycnotic, and disintegrate with release of virus and viral antigen. Other cells in the culture that are not at the appropriate stage to support viral replication continue to phagocytize and accumulate viral antigen in their cytoplasm. A second wave of viral replication can be induced if these cells are stimulated to enter the S phase of the cell cycle as, for example, by the addition of fresh culture medium.